Good evening, everyone. I am Dr. Nupur Gupta, practicing gynecology in Gurgaon at Well Women Clinic and working as director in the Department of Obstetrics and Gynecology at Fortis Memorial Research Institute, Gurugram. The topic for today's discussion is raising awareness on sexual health, as we are celebrating this September as Sexual Health Awareness Week. Reproductive and sexual health of women is a state of complete physical, mental, and social well being in all matters relating to the reproductive system. It implies that people are able to have a satisfying and safe sex life, the capability to reproduce, the freedom to decide if, when, and how often to do so. We have with us today Muskaan Paintal from Girl Up Avtaar. So over to you, Muskaan, and welcome on the live Facebook today to discuss about sexual issues for young girls and adolescents.
Thank you, ma'am, and thank you everyone. First of all, who have been trying to connect. Sorry for the technical error. Girl Up Avtaar is a club under the Girl Up campaign, which is a UN initiative. Our goals for this year is to work against domestic violence and to work for menstrual hygiene and empowering women. Today, we are here to talk about sexual health because this week is being celebrated as Sexual Health Awareness Week. We have some questions and topics prepared for ma'am, and I would like to begin with discussing about some basics, which is why is sexual health important and how should we take care of it?
Thank you, Muskaan. This is a very important topic which is much less talked about because of the stigmas attached to it. And like our mental health, our emotional health, our financial and economic health, sexual health for women is very equally important because it is related not only to their intimate life but also a part of their emotional well-being. And how do we look after our emotional health is like health of our own body. There is nothing new. So number one, to eat healthy. Number two, to have a healthy BMI or a normal weight. To avoid alcohol as much as possible along with recreational drugs. To not smoke too much and not to be on drugs, to be effectively able to communicate with your partner, which is a very important part of having a good sexual health, and to know that how can you protect yourself and not get affected by any infection or an unwanted pregnancy.
Yes. And since we're discussing how intimate issue this is, do you also feel that we can consider it as a public health issue?
Yeah, definitely. It is a matter of public health concern and was also highlighted and included as one of the measures in WHO, that is the World Health Organization in 2015. And lot of such organizations that work for health of women are working hard to create awareness regarding these issues and to address the unmet needs related to visit to a gynecologist or protection against infections for young women, to educate them, to empower them so that they can protect themselves and also help others do the same.
Right. And talking about women's health and vaginal health specifically, because many people have this notion that they try products like clean and dry, which we are not sure of. So, what do you suggest? How helpful are they?
See, Muskan, vaginal health, you should always know what are the do's and don'ts. And vagina will protect itself against any kind of infection because it tries to maintain a normal pH between 4 to 5. And there are healthy bacteria that we call as lactobacilli. And vagina also has normal bacteria as well as candida or fungus. But whenever the pH gets altered due to whatever may be the reason, that is the time when the infection sets in. And when we are not adopting safe sexual health practices, or maybe we are not aware how to look after, how to protect ourselves. So it affects lot of parameters in the life of women, not only their sexual life, but their fertility. When they get infected, there are chances of pelvic inflammatory disease, There are chances of fertility issues later on in life, which they don't realize at a young age, because sometimes infections that happen and there is no record. We don't know what happened. Mostly it will clear from the system in some time, but in the long run, it can also produce fertility issues. So it is very important to understand and not be misusing these products that are available off the counter. They are not treating you or protecting you from any kind of infection. They are also neither antibiotics nor antifungals. It is only if they make you feel comfortable, you are more than welcome to use, but they are not the ones. If you think that I have not used this and that is why I got urine infection, I got vaginal infection, that is not true. It is a myth related to such issues. Very important is to maintain your own hygiene and to know what are the measures that will protect you from pregnancy as well as against any kind of infection.
Right. Talking about pregnancy and contraception, what do you think is the role of barriers, and when should an adolescent especially visit a gynecologist?
Yeah, so for adolescent in India, it is still a taboo. But yes, in metro cities, a lot of adolescents are aware that they should have a gynecology visit or a contraceptive health visit before they actually indulge into sex. In Western countries, usually in grade 11th or 12th, they already have their partners. In India, it is not so common, but we are not aware of it, and things are have also started becoming prevalent here. So it is our duty as parents, as school representatives, as counselors, to educate them at the right time, and so that they can openly talk about these issues. And it is very important from a gynecologist point of view that confidentiality is maintained, and they are very comfortable to talk about what are the contraceptive options they can go for, how is it will protect them. And when they come to us, that is an opportunity for us also to talk to them about protection against cervical cancer, because cervical cancer happens from human papilloma virus, which is a sexually transmitted infection. So if we immunize the adolescent girls at the right age, which is between 9 to 14 years, before they are sexually active, before they go to college, before they don't even know what is actually sex life and what is it to have a sex, it is very important that they should know that what are the barriers that are available, and barrier will protect them not only against pregnancy but also a lot of other sexual infections. So it is important to have the right knowledge, and it is our duty to educate and empower them so that we don't land up in more morbidity for their lives, leading affecting their mental health also to a large extent.
Right, absolutely. And since we have gynecologists like you who are so open to discuss it, and I think, what are the expectations and concerns the adolescents come to you, or what do you think are important for their knowledge?
See, what they don't come to us for is sexual infections. Unless there is a big lesion or there is an ulcer, there is a painful ulcer, which sometimes happens in herpes or in chancroid. But for vaginal discharge, unless it causes too much itching or there is a foul smell discharge, they don't come to us. But it is very important to visit at the right time. And what we do is we treat both the partners and not just one person, because treating one will never solve the issue and they will keep getting infections again and again. And what is also important is that we need to emphasize that there are short acting contraceptive options, there are long acting options. And if you are aware of it and if you have the right knowledge, what is good for you, what is your history, you can discuss with your partner before you indulge into anything.
Right. And talking about other sexual infections, what are the infections that we usually don't know about but are very important to diagnose and prevent?
Yeah. So there are two sexual infections for which vaccination is also available. Number one is hepatitis B, which I think most of the population is immunized against, which we give at 0, 1, and 6 months, because this also gets transmitted through sexual intercourse. And another is HPV infection, which is human papilloma virus, which is also responsible for so many other cancers in men and women. For females, very important is protection against cervical cancer, although it is relatively expensive, so a lot of people can't afford. But people who can afford, it is our duty to make them understand that how only some amount of money can protect you from cancer in the long run. Other infections that are common, which we see in clinical practice, is gonorrhea. It is a kind of other than gonorrhea, we have chlamydia, which we see quite often. There is herpetic infections, herpes, if you have heard of. So there are two kind of herpes. One happens on the face and mouth, that is herpes simplex 1. And there is herpes simplex virus 2, which is a genital herpes, which usually presents in the form of painful vesicles or ulcers. Although we give antivirals for this, but that is only giving you some symptomatic relief. And once it happens, usually you get immunity in the long run.
Right.
Two more common infections are trichomonas and bacterial vaginosis, which sometimes is difficult to differentiate between the two unless we do a testing or we send a vaginal swab for testing. But what we do is we treat it as mixed infection, as common infection, which will cover all these at one time, so that we don't have to call them again and again. There are no multiple visits, and treatment is done at the same time.
Since you talked about so many infections, at least I hadn't heard about. So, what is your message for us adolescents and both women and men who are now uh, adulting, as people say? So, what do you think? How should they approach a gynecologist? Like now we know the issues, but there's a social stigma around approaching a gynecologist and talking to someone about their sexual health.
Yeah,
What
yeah.
do you think we
So
can break that?
it is very important if both of them can come together to a visit, but if not both, at least one person, so that the choice becomes easier, that what is the best option for you. As far as what we talk about, it is one of the most challenging consultations, let me tell you, that we do in our gynae practice, meeting an adolescent or a teenager who has lot of knowledge, but sometimes incomplete knowledge due to Google, and sometimes lot of psychological stress that I have acquired this infection, now what should I do? So in our history taking, it is very important. We usually focus on 5 P's. So first one is whether you have one partner, you have multiple partners, whether you are protecting yourself against pregnancy, what protective measures are you taking to protect yourself from sexually transmitted infections, whether you have a past history of sexual infection, what are the safe practices that you follow. So that includes that covers up lot of aspects. And we also encourage them to know about what is emergency contraception. So emergency contraception has been introduced in India only few years back, and that is a contraceptive pill. So we prescribe in the prescription that in case of unprotected intercourse or unprotected sex, this can be taken. This is available over the counter. This is how you need to take it, and please don't miss it. Take it as soon as possible, or within 72 hours is the best time. But sometimes you can have irregular bleeding, and sometimes there are failures as well. So so be vigilant and come back if need be. But we need to make them understand that at adolescent age, it is a very tender age, not only emotionally, but they need to understand that the risk of getting infection in the female partner is much higher than the male partner. So they are more prone even at a younger age to get sexual infections. The more partners you have, the more risk you have of developing cancers later on in adult age, more chances of unintended or unwanted pregnancies, which happen at this age, more chance of mental health trauma, emotional health issues, financial instability. Even if you plan to continue poor antenatal care, you don't want to visit the doctor, your social life takes a toll, your emotional, your personal, lot of issues crop up. So it is very important to take the right measures at the right time, and it has been seen in all socioeconomic strata. When we talk about contraceptive options, barrier is one thing. Emergency pill is only for emergency, but not as a regular contraceptive method. But there are short acting and there are long acting contraceptive methods that are available, which can be customized based on your requirements, that what is the best choice for you at this age, and how often would you need a contraceptive choice. So in US and in developed countries, they more often go for long acting methods where sometimes a contraceptive implant is inserted under the skin, or a intrauterine device is placed in the uterus, or they can be on contraceptive pills or Depo-Provera. But in India, we are not very comfortable giving this to our daughters and to the young generation. But it is much safer than to have an unplanned or an unwanted pregnancy in the long run.
Right.
Yeah.
So, yeah, lastly, I want to ask, what are the popular myths about vaginal health or sexual health?
Hmm. So vaginal health issues can be many other. One is to not able to have sex properly, which is called dyspareunia or a painful intercourse. Sometimes it can be due to only psychological issues, which we call it as vaginismus. And sometimes it can be due to some vaginal infection. It can be simply due to your pelvic pain, or it can be a pelvic inflammatory disease. There can be a vaginal cyst for that matter. So it is very important to examine and find out that what is the exact cause which is causing a problem. In elderly women, what happens is, the in menopausal women, the introitus becomes very narrow, so it is painful because of hormone changes. At young age, sometimes there are sexual infections that are unidentified, but the only symptom is pain while passing urine, pain while having intercourse, pain while passing stools. So if they come to us at the right time, the right diagnosis can be made and we can guide them in a much better way. Other than that, what vaginal problems they can have is, sometimes there is vaginal bleeding. We don't know what is the cause. It can simply be a cervical erosion, or there can be vaginal infection that is called vaginitis. So a lot of them have heard this topic, that what is actually vaginitis. So it is very important to use barriers, which can be a female condom, that can be a male condom, to reduce the amount of alcohol and smoking when you are planning for such kind of activity. No recreational drugs, so that your mental health balance is right. Not to feel embarrassed that you need to visit a gynecologist. But now, after teleconsultation has come up, don't lose this opportunity. Educate yourselves, empower yourselves, and be responsible for your own health. And nowadays, there is no problem of accessible to good health. Availability is also there. So take this opportunity, visit your gynecologist, and address all your contraceptive health needs. Your expectations, whatever are your concerns, should be very clear before you go into all these things. And that is how we can prevent sexual infections. We can prevent so many morbidities related to unwanted pregnancy and infection. And at the same time, the parents also need to be aware of that, to immunize their daughters with vaccine at the right time, so that we can offer this protection to them like girls of any other developed country. We are not able to provide these services. It is still not free of cost to the vulnerable population. But you can go for pap test. So any girl who is 21 years and above and is sexually active can go for a pap test, which is a just a smear and not a very painful test. So don't be fearful, but get yourself checked at the right time, so that we can avoid lot of things in the future. So to have the right information at the right time is very important. Nowadays, schools are also playing a very important role. Organizations like yours are working to educate and empower and engage them in their own health, and that will really help to reduce not only reproductive and sexual health issues but also morbidity which is related to getting infection at a younger age, which will prevent them from lot of diseases in the future.
Right. So, ma'am, shall we conclude?
Yes, Muskan, I will just check if there are any questions. Any would like to ask something. So you were also discussing about. So there is a question that says that are gynecologist and sexologist the same? So I will answer this question. That gynecologists look after the sexual health of women only. They are not sexologists. They are different. When you think that the male partner also needs help, then then their role comes in, or you can also visit a urologist for the same. There is another question that is there any setback of the morning after pill? So yes, morning after pill is the same thing which you are talking about, is the emergency contraceptive pill, which number one should not be used as a regular contraceptive pill. Then it will have its own side effects. You will have irregular periods. Sometimes you can develop a cyst. Your cycle will get disturbed. And even if the pill fails, then what will happen is you will not know that you have conceived. So it has to be taken with lot of vigilance and not as a routine thing. And if you think that you can take multiple pills in one cycle, that is not the right choice. Only one pill per cycle will be effective. Taking it again and again will not help you in any way. In fact, it will lead to more side effects. It has very large quantity of a hormone, that is progesterone. Rather than the need, if you think you have the need to take multiple doses of this emergency pill, it is better to go for a regular contraceptive method. So Muskan, there is one last question that can you talk about endometriosis? So yes, endometriosis produces pelvic pain, which is a menstrual pain that lot of women face, maybe from young age, and lot of times we miss at young age, in adolescent age, when they come to us with painful periods, that it is likely to develop into endometriosis in the long run. So what is endometriosis? This is only the endometrial lining which is normally in the uterus, but other than uterus it is located at other areas in the pelvis also. So like this endometrial lining bleeds every month. You have a menstrual cycle every month. So what happens during this menstrual cycle, wherever this endometrium lining is present, whether it is back of uterus, whether it is in your ovary, anywhere in the pelvis, on the urinary bladder, on your intestine, it will bleed every month. So every month if it bleeds, there is a collection and your next period will be more painful than the last one. Usually women have period pain only at the time of periods, but this has a varied and atypical presentation. It can make you feel painful the entire month, or only before periods, only during periods. It can have different forms the way it manifests. But yes, we don't have to worry. Earlier we used to diagnose only by doing a laparoscopy, but now clinically and by some parameters, sometimes chocolate cyst can be seen in the ovaries, so we are able to diagnose early. Sometimes they present with painful intercourse. They sometimes present not only with period pain but with fertility issues, chocolate cyst on ultrasound. But they are treatable, and new drugs have come up which can help to a large extent. And very important is to diagnose at a young age, because this becomes severe when we are not able to diagnose at a younger age. There is one more question. Another gynae suggested my friend to consume that pill after every intercourse. Now it all feels like bad. See, regular contraception is something different. A regular contraceptive pill will have both estrogen and progesterone hormones. It will not have just one. Emergency contraceptive pills are many. In India, we have this levonorgestrel pill, which you know it comes by names of I pill or pill 72. In other countries, there is another drug which is called ulipristal, which is also available as emergency contraceptive pill. In India, we can also use copper tea within 5 days of intercourse. It is very effective to avoid pregnancy. So we need to understand that emergency contraceptive pill is not preventing pregnancy. It is not. So once the fertilization has happened, it will not, it is not effective. So no matter how many pills you pop up, it will not be effective. Emergency pill is not working at that level. So the oral contraceptive pill, it inhibits the formation of the egg. So what you need for pregnancy, you need three things. One is egg, one is semen, that is the sperm count, and another thing is the tube. The tube should be open. So if we inhibit one of the factors, so contraceptive pill will inhibit ovulation, means formation of the egg. So, and that is how it protects against pregnancy. In some cases, it will also thicken the cervical mucus so that the sperm cannot travel from cervix to the, from uterus to the fallopian tube. So emergency, we should not misuse emergency contraceptive pill. It is only for condom rupture, breakage, or maybe at the time of rape or unplanned intercourse or unprotected. That is the best time so that you can avoid an unplanned or an unintended pregnancy, but not as a regular pill. It will produce more harm than good. So avoid doing this. And one last question. So, can we use regular soap instead of V-wash for intimate hygiene? Yes, this is a very good question. Regular soap is as good as using any vaginal wash or these hygienic products, because vagina has a normal cleansing mechanism. All the microorganisms, bacteria, you will only get infection when the when you don't take regular practices which we discussed earlier, how to have a good sexual health. Only only if we don't follow the regular things which are needed for a good health, then you get the infection. Despite that, if you get infection, we can do test to know what is the specific organism. Very important is also to treat the partner so that you don't get infected again and again. And remember, it is very important that women are more prone to sexual, vaginal, urinary infections as compared to male counterpart. But whenever there is infection, we always advise the partner to be in the consultation or in the counseling, so that we can make them understand that we need to treat both the partners and not just one, so as to prevent recurrence in the long run. But they are all treatable. We don't need to worry about that the infection happened because I had to use an unhygienic loo or a washroom. All this will not happen if we look after the health, and if we know exactly what is the cause. So Muskan, there is one more last question. How should a UTI be treated? So, so urine infection is very common in females. I think everyone has in their lifetime once or twice. But we need to know what are the risk factors to have recurrent urine infection. Routinely, what you can do is to avoid infections if there is no risk factor, and if you think everything is good, all systems are working fine, there is no stone in the kidneys, there is nothing wrong, there is no risk factor, you are not pregnant, you are not postmenopausal, you have no kidney issue, then what to do? How can we prevent urine infection from happening? Number one is not to hold urine, to keep, to go and pass urine, and don't think that this is unhealthy, so I cannot. That is not right. So don't hold. The more you hold urine, more chances you acquire infection, and the collected thing will catch more infection. Always pass urine after having intercourse. Don't hold for a longer time. If you think you have urinary infection symptoms, take lot of fluids. As a routine also, you need to take lot of fluids. Other than that are the general measures. Avoid lot of caffeine in your diet. Too much coffee, too much tea, too much nicotine, too much alcohol. All these things are precipitating factors. A good night's sleep is equally important. If you think that you can work 24 hours because you have that much potential, but no, you are also a human being, so you need adequate rest, and you don't get prone to other infections. If you are taking regular hot water baths, that is not a good idea. The vaginal health also gets altered. Sometimes there are coexistent urine infection as well as sexual infection. So whenever there is urine infection, it is mandatory and it is part of our training that whatever is the complaint, a pelvic examination is mandatory to rule out where exactly is the infection, because symptoms are mostly the same. Unless the girl is unmarried, is not sexually active, we will not do a pelvic examination. But otherwise, it is very important. Nowadays, we also have cranberry extract that is available in the form of tablets, and that works like wonders. That will help you to prevent recurrence. Very important not to pop in antibiotic when you feel symptoms of urine infection, because you are increasing the infection more. You are not treating the cause, you are not treating the organism, but you are making it more resistant to treatment. So every time, don't go and look up at your previous prescription that this was the prescription that I got 6 months back, let me take this again, I will be okay. But in 95%, you will not be okay in repeating the same prescription again and again. So Muskan, I think we should end our session here today, and we can
Yes.
take up more questions in the maybe next session, or anyone else who is left can also share in the comment section. We will get back to you.
Yes, I think it was a great discussion for many people in the on the live, because usually people don't talk about these things, and now I hope everyone knows that it's important to talk to a professional and not just Google. If you're using Google, you should use it to contact a gynecologist, not to self-diagnose.
That is very good. That Google for who is the right person who can help you, and not the symptoms, because symptoms are variable and there is lot of overlap, and it is not easy to identify that what is the problem. Simple pelvic pain can just be a cramp. It can just be an abdominal cramp. So don't go after that, because sometimes people come to us saying कि pelvic pain hai, I have an ovarian tumor, that is why I am having pelvic pain because I read about this. So we should not, in India, it is still not a problem to have help from a doctor. They are just a call away. So take this opportunity and look after yourselves. Thank
Yeah.
you.
Thank you, ma'am. I think with gynecologists like you, people will definitely come up, and with organizations like us, people will start a dialogue.
Sure. Thank you. Bye.
Thank you. Bye bye.
Thank you. Bye bye.